facility, a lack of resources, a lack of funding. So then we can using the control map to address the solution that should to solve the problem. For example, for the lack of the resources of funding, so maybe the solution is we are increasing the financing like that. On the second sessions, we discussed about the financing choices in moving towards universal health coverage. Talking about financing universal health coverage, we consider it two sides, supply side and demand side. Supply side, we are concerning about providing sufficient health facilities and services to the people, and also make sure the efficient cost of delivering the services. And regarding the demand side, we're concerning about the equity and the easiness of the people to access the health services, and also to make sure that we are providing the risk protection for the financial risk protection for the people. And then by financing can also be used to improving the efficiency and the quality of the health services. There is three alternative ways to get the health services. First is that the government provide and pay all the cost of the health services provision. The second is by using the social health insurance mechanisms. And the three, that the people still need to pay by themselves for out-of-pocket expenditure. Using the financing options is quite difficult, depending on the people structure, because if the mostly considering of the formal sectors, then it can be overcome by using taxation to financing the health insurance. But if there are a lot of informal sectors, it's quite difficult to just using the social health insurance. And then there are four financing functions. First is mobilize and collecting funds. 2, pooling the risk. 3, allocate the resources. And 4 is about the payment to the health services provider. How to collect funds? There are several ways. First of all, by paying by ourselves out of pocket. Second, by using taxation. The third, by using insurance. The fourth, by using the saving accounts. And fifth, we getting donor aid from the other. After lunch break, we've learned about using social health insurance to get to universal health coverage. So we're using social health insurance as one of the financing method. Can it help us to reach the universal health coverage? The answer depends. Sometimes it can help us, sometimes it would not. Why? Because it depends on several factors. First, whether we use the social health insurance as the end of our goals, or it's just a tools for us to reach the outcomes, the final goal. So if it's better that we are using social health insurance as a means, as one of the means of us to reach the universal health coverage. And then by using more or multiple financing or more insurance doesn't mean we'll give you more protection of the financial risk. So it doesn't always mean that if the country have many kind of insurance, it doesn't mean that it will ensure that the people is safe from the risk protection. And also the last one, the government, by providing free care or free health services to people, can also help or give the financial risk protection to the people. And last but not least, we've learned about the persuasion and behavior change. So in order to address the problems, we cannot rely only by using regulation or other methods. We have to also encourage people to change their behavior. Because many people, especially nowadays, living in unhealthy lifestyle, so we need to change their behavior, their mindset, and increasing the awareness. So by using persuasions, we hope that people will eventually change their behavior live more healthy, so it can help governments to overcome the health status problems. That's all that I can share with you. Thank you very much.